Hey there, lads. Have you ever wondered how a single court case could transform mental health treatment in America? What if I told you it all started when a state decided to cut its cigarette tax back in the 1970s, leading to a reduction in mental health services?
All right, that is my attempt at an Irish accent. If any of you out there are Irish, please let me know how I did. So for today's video, I thought we would dive into the captivating story of Wyatt versus Stickney and its monumental impact on mental health care. So picture this, it's the early 1970s and Alabama's mental health system is in dire straits. Due to a reduction in the state's cigarette tax, Bryce State Hospital, a mental hospital, faced a series of budget cuts, resulting in the firing of 20 mental health employees. By the way, does anyone find it odd that perhaps a primary source of income for a mental health institute was derived from an unhealthy activity like cigarette smoking? Actually, now that I think about it, it kind of makes sense. I think I must be like philosophically dyslexic. So anyhow, these fired employees, along with a patient named Ricky Wyatt, decided to sue the hospital for providing inadequate treatment to its patients. Ricky Wyatt, a 15-year-old mislabeled as a juvenile delinquent, was wrongfully admitted to Bryce Hospital, a mental health facility. Despite not having any sort of mental illness, Ricky found himself trapped in the hospital for years, enduring horrific conditions like sleeping on wet floors and being locked up in a dimly lit room. He even witnessed supervisors forcing patients to fight each other for their own twisted amusement. And to make matters worse, Ricky was awakened by being poked with a broom and had hot water thrown on him. And if that wasn't enough, he was placed in a rehabilitation program for drug and alcohol use despite never having used either of those substances. Ricky Wyatt wasn't about to let this slide, and in 1970, with the help of his aunt, fired employees, and an attorney, he filed a lawsuit against Bryce's hospital's superintendent, Dr. Stonewall Stickney, and so Wyatt versus Stickney was born. Now you might be wondering, well, why did he sue Dr. Stickney and not the hospital itself? Well, as the superintendent of Bryce Hospital in Alabama, Dr. Stickney held the highest administrative position and was responsible for overseeing the facility's operations. And so by suing Dr. Stickney, the lawsuit targeted the person who was effectively in charge, which challenged the entire hospital's practices and conditions. In a groundbreaking decision, the court ruled in favor of Ricky Wyatt, establishing the right to treatment for people with mental illness. This crucial principle means that individuals with mental illness are entitled to receive adequate, humane care in mental health facilities. It may seem like this is kind of common sense, but at the time it wasn't. And as a result, these facilities had to clean up their act and provide appropriate medical treatment as well as individualized plans for patients to meet their specific needs. The impact of Wyatt versus Stickney was really monumental in that it sparked a nationwide movement to reform mental health care and establish minimum standards for treatment in mental health care facilities. Before this case, Alabama's track record for mental health care was absolutely abysmal. The state ranked last in the nation for its expenditures on the care of people with mental illness or other mental health conditions. And shockingly, the state only allotted a measly 50 cents per day per patient, which would equate to about $4 in today's currency for patient treatment. Isn't that just crazy? After the hospital laid off its workers, there was only one nurse for every 225 patients. And I can tell you as a nurse myself, there's been times when I've only had 6 patients. And because of the acuity in the unit, I'm like, sweet mother of God, I wish we just had 3 patients today. So I can't imagine what it would be like to be that one nurse and have 225 patients. Talk about setting up your nurses for failure. And I really feel like that nurse to patient ratio really highlights the lack of emphasis placed on mental health care in the state of Alabama. Nevertheless, thanks to Ricky Wyatt's courage and the efforts of his aunt and the employees and the lawyers involved, appalling incidents like patients dying from accidental poisonings, or a boy whose spleen ruptured after a hose was inserted into his rectum, or a resident who was restrained in a straitjacket for 9 years just to prevent finger sucking, were exposed, and the mental health care system in America began to change for the better. Wyatt versus Stickney didn't just create a ripple, it caused a tidal wave in mental health care. This case, along with another prominent case, played a significant role in deinstitutionalization, drastically reducing the population of state psychiatric hospitals. For instance, in Alabama, they saw a 2/3 reduction in patients between 1970 and 1975, even as expenditures increased by a whopping 327%. And just so you know, if we increase 50 cents per day per patient, which is what Alabama was spending before this whole snafu was exposed, if we increased 50 cents by 327%, hold on to your horses. We're now spending a lavish $2.13 per patient per day. This was back when the US was spending about $33 billion per year, about 8% of our national income on military spending, while having a whole lot of fun over in Vietnam. But I digress. Wyatt versus Stickney really inspired similar litigation in similar states like Louisiana, Minnesota, and Ohio. And instead of facing costly court-imposed standards, many states just decided to empty their hospitals, transforming the landscape of mental health care across America. And guess what? Wyatt versus Stickney also gave birth to the Mental Health Law Project, also known as the Bazelon Center for Mental Health Law. It was founded by 4 attorneys, some of whom worked on the Wyatt case, and this project really became the driving force behind the mental health legal movement, further restricting involuntary treatment and expanding the right to refuse treatment. Talk about a lasting legacy. So there you have it, the plight of a 15-year-old boy. I think when I was 15, I was still probably sucking on my thumb, who had the courage to stand up to injustices, drastically changed mental health care here in America, and for the better. And I really feel like this case serves as a powerful reminder that standing up for what's right and fighting for change is crucial even when faced with seemingly insurmountable odds. Thanks for watching, and we'll see you on the next vid.